Hey guys, Dr. Lee here. I Head to Toe Spine Sports Therapy. I'm here with Barry Appier. We're going through a nice little laser setup on his forearm. He's having a little bit of pain in his forearms and his wrists, and we want to help him out, just deal with some of the tendonitis. Maybe he's having a little bit of inflammation that's getting trapped. Either way, the laser is going to help a lot with that. It's really good for any soft tissue injuries, whether it's muscle, tendon, ligament, but also good with helping the lymphatics to flow a little bit more. And just overall improving homeostasis in the system, which is just optimizing function, realistically. So laser works in a couple different ways. I'm just going to get started while we talk about this. So the light itself is going to stimulate these cells to make more ATP. The mitochondria, that powerhouse of the cell, if you remember your biology class, is what we're stimulating with this light. So the light itself is going to bring in heat. The actual wavelength of this light is going to stimulate the mitochondria to make more energy, and that in of itself is going to, one, increase blood flow, but because we have more energy available to those cells, their functionality is going to go through the roof. So when we're talking about a cell healing, if there's more energy available for those cells to kind of do their work in overturn, then they're more likely to complete their function at a faster rate. So ultimately we're doing this to decrease healing times, but also to decrease pain and inflammation. So something that we're doing right now is we're going through the forearm. You don't necessarily have to move this, but because we're using a bigger treatment area, we do want to move it a little bit. What Barry can do here to kind of supplement some of this movement is like what he's already doing in flexing and extending his fingers. That's going to expose different parts of the muscles to essentially allow the laser to access them. So I really like this laser for any tendinopathy. And some cool stuff that I've seen it work really well with is neuropathy. So whether that's from somebody that's gone through chemo, or that's somebody that's had diabetes, or just long-standing nerve pain and issues, laser is really effective with dealing with those types of patient populations. And the research is coming through day after day, and more is coming out that it's very effective. Ultimately, I think it's eventually going to be the golden standard for treating that type of issue. So if you have that type of stuff, I would definitely recommend laser treatment. This right here is a class 3 laser. There's 5 different classes. The 5th one you definitely don't want to come across because that's more military grade.
Star Wars.
Exactly.
Yeah.
Shooting lasers and laser beams on sharks' heads and etc. So this class 3, just because of the nature of the laser, it's not going to burn any tissue, so we don't have to keep this moving, but we want to. So that right there was a quick 2-minute treatment. Barry here, the only thing that he's going to feel is heat from the laser. You might actually feel a little bit more flexibility in the area as well. But essentially, there's not really many contraindications to this type of therapy. It's either going to work for you or it's not. The main thing that we want to avoid is we don't want to put the laser on tattoos. So I was avoiding that the whole time we were treating, just because the metal in the ink is going to heat up just because of the light. So that leads into we don't want to put it on any rods or screws. So if you have any hardware, any broken bones, that's going to be another contraindication. But realistically, laser is good for most things. It's definitely a good little supplemental therapy to have here. We're going to use it with a lot of patients, but we're also going to have laser plans if you only want to access a laser. So if that feels like something you want to get into, something you want to try out, I would call the head desk, talk to Sisler or Megan, and get an appointment signed up. Thanks, guys.